Parkinson's disease is a movement disorder that is mainly diagnosed by clinicians and is identified based on clinical features. One of my missions is, as a clinical pathologist, which is what my clinical training is to develop an objective set of parameters such as a lab test, which would help us diagnose Parkinson's disease more accurately. Our lab uses mass spectrometry for identifying proteins and to quantitate their levels, and we would like to use these technologies to identify protein biomarkers for Parkinson's disease. Our work can help other researchers in many ways. First of all, we could elucidate mechanisms that would underlie pathogenesis of Parkinson's disease that could spur development of new therapies. Our work could also lead to early diagnosis of Parkinson's disease. It could be used to monitor the effectiveness of therapy for Parkinson's disease in clinical trials. Our work, if successful, could lead to development of biomarkers that could allow for early diagnosis of Parkinson's disease. It could also help us differentiate Parkinson's disease from other neurodegenerative disorders, and equally importantly, it may help us diagnose those people with a family history of Parkinson's disease or who are otherwise at high risk of developing Parkinson's disease early. We are using very advanced and sensitive technologies to detect proteins and to quantify protein levels, and this is being used to identify proteins whose levels can help us with a more definitive diagnosis of Parkinson's disease. And our hope is that if such biomarkers are identified, we'll be able to more precisely diagnose Parkinson's disease and possibly monitor it and fine-tune therapies. We expect proteomic technologies to become more and more sensitive in the future, and that will allow for earlier and more precise detection of Parkinson's disease in patients, and we expect certain technologies and methodologies to evolve so we can take a global view of pathways that could shed light into the mechanistic basis of this disease, which might help us develop new therapies.